Good afternoon. On behalf of all of the speakers and organizations represented here today, I'd like to welcome you. I'm Richard Ralston from Americans for Free Choice in Medicine. Today we will hear from a number of speakers with many years of experience in the analysis and advocacy of healthcare policies, all consistent with the American values of individual rights, personal choice, and free markets. We are brought together by a common concern about the immediate threat of great harm to American medicine from legislation now working its way through Congress. We may not all agree about every detail of health care or other public policy, but we do agree about the urgent need for action now to stop a huge surge of government intrusion in health care. It appears to be an uphill battle, but we will have to wage that battle with confidence. If we are defeated, it must not be because no one has articulated a clear moral imperative to defend the rights of physicians to practice medicine and the rights of patients to seek medical care as they think best. That's why we are here today. During dark days at Valley Forge, George Washington had his favorite play, Joseph Addison's Cato, performed for the Army. It dramatized the tragic struggle of Cato the Younger against the destruction of the Roman Republic by Caesar and others. In one scene of this play, Portius, a son of Cato, says to the senator Sempronius, quote, "I'll straight away, and while the fathers of the Senate meet, I'll thunder in their ears their country's cause, and try to rouse up all that's Roman in them. 'Tis not in mortals to command success, but we'll do better, Sempronius. We'll deserve it." End quote. The fight for freedom is nothing new. It was necessary 200 years ago and 2,000 years ago. It is necessary right now. This fall, win, lose, or draw in Congress, we will have to spend the rest of our lives thundering in the ears of Congress, trying to rouse up all that's American in them to make sure that our clear moral arguments for freedom achieve the success that they deserve. Dr. Arthur Astorino, Jr. is an ophthalmic surgeon in Orange County, California. He is the chairman of Americans for Free Choice in Medicine, which he founded in 1993. Based on years of observation in his own medical practice of the harm caused by government regulation, he is a tireless advocate of more freedom as the best and only appropriate means of reform. Would you welcome Dr. Arthur Astorino, Jr.?
Well, thank you, everyone, for visiting us on a Saturday, and thanks for those two introductory talks. They're wonderful. Americans for Free Choice in Medicine addresses the healthcare reform debate from a principled standpoint. Our plan's overriding principle is respect for human life through preservation of individual liberty. We recognize that the fundamental problems of healthcare financing is ever-increasing government intervention into medical economics through tax laws which discriminate against individuals, government medical programs that substitute for private charity, and licensing and regulation. How did I come to such conclusions? Well, one thing that should be readily apparent is that I am one of the few physicians discussing healthcare reform policy. Being a physician, I can bring a couple of unique aspects to the debate. But the one that I want to focus on today is a certain method of thought. As physicians, we're trained to distinguish between symptoms and causes. A proper diagnosis prior to implementing treatment is required. Time will permit that I only touch on a few issues pertaining to the diagnosis and cure of our current healthcare financing problems. But what I hope to accomplish is that you will gain a new insight onto how to look at these problems. When you hear someone state a problem with healthcare, don't take it for granted. Question whether or not there is something deeper at root. I hope that you will recognize that the vast majority of the purported solutions are superficial, attacking only the symptoms, and will result in compounding the problems. Let me give a medical example. As an ophthalmologist, I'll often see a patient with a red, painful eye. Now, a superficial approach to that would be to recognize that the eye is red and acknowledge the complaint of pain. A simple solution would be grab a decongestant to whiten the eye and give a Tylenol for the pain. This results in temporary relief, but the condition will worsen. This is the kind of superficial approach that treats the presenting symptom as the problem, and this is equivalent to what is being done with our healthcare proposals today. But that is not the way a physician treats a patient. What we do when a patient confronts us with a problem is to recognize them first as symptoms, and then take a history. We characterize those symptoms more fully, we find out when it started, and we see if there are any other associated symptoms. In the case of the red eye, for example, we may have found out it happened 2 days ago, and our exam may show us that it's a simple pink eye. However, when we ask more questions, we may find out that the patient's having joint pain, and our exam may show inflammation in the eye. We take further history, and we elicit symptoms of weight loss, fatigue, fever, and cough. We find out that the patient was traveling in an area where TB is endemic and was exposed to someone with an active cough. We take an X-ray, and we have findings consistent with TB. We discover that all these multi-system symptoms are all a manifestation of one single cause, tuberculosis. Once that diagnosis is made, the actual disease can be treated by killing the organism with the proper antibiotics, resulting in the elimination and cure of all the multi-system symptoms, one of which was a red eye. It is this aspect of the analogy that I want to make clear. When we do discover a fundamental truth in reality, like the truth that all these disparate symptoms are actually caused by a single etiologic agent, TB, attacking that fundamental is what is needed, and that results in curing all the other symptoms. So let's move on and take a history of our healthcare finance and review some of the prominent symptoms. There's often a complaint about employees who lose their health benefits when they leave their job, being uninsured during the transition. Another related problem is called job lock. This refers to employees that feel trapped in their current job because a family member may have come down with a condition such that if they leave their job, they'll be uninsurable. Together, these types of problems are referred to as lack of portability. Now, is this the fundamental problem that needs to be addressed? Or is there a deeper issue involved? To find out, let's take a history and let's ask some questions. The first question you might ask is, why do people get their health insurance from their employer? When did this start to happen? Was it always the case? And getting ahead of yourself, you might ask a couple other questions. If they could get it elsewhere, would this problem be eliminated? That is, if people personally own their own health insurance policies, would that eliminate this issue of job lock? If people own their own personal insurance policies, would it be a problem when they lose their jobs? If they shopped, chose, purchased, and owned their own health insurance policies, and therefore were aware of the terms of the contract, would they purchase coverage that dropped them once they were sick? And if it were not illegal to do so, would they choose only the coverages that they wanted and not spend money on coverage that they didn't want or need? So, if owning your own policy would solve many of these portability problems and others, why do employers own them? Our history must take us back to around 1940. At that time, there were 20 million insured Americans, representing only 16% of the population, and the insurance was mostly covering hospitalizations. Therefore, 84% of Americans were uninsured in 1940. Did that mean that 84% had no access to health care? Did 84% not visit a doctor? Did they not get surgeries or treatment? Of course they did. At that time, access to health care and receiving health care was not synonymous with health insurance. And it was generally affordable without insurance. My grandfather, who was an apprentice tailor at the age of 8 and came over to this country when he was 16, never had health insurance, and he paid for everything for his family his whole life cash. Now, you may be thinking that medicine was less sophisticated then, less technological, less advanced, and that is why it was affordable in 1940 without insurance. However, weren't automobiles less advanced, telephones less advanced, computers less advanced? How is it that they became more advanced, more powerful, more life-enhancing,